My name's Sheila Caldicott and I'd like to talk to you today about teenagers and access to the medical records. I'm a patient at Thornley House Practice. The first thing to think about with teenagers, from a parent's point of view, is the decisions that we have to make. When do we let go? When do they take over? When do we see health professionals? When do they see health professionals on their own? And how do we get them to that position? How can I support my child with his health matters? Well, as a parent, we've already been doing this from birth. We're continually teaching our children how to manage their health by example, by training, by giving them tasks to complete themselves. We've seen and done this from babyhood, toddlerhood, going to school. Now that they're teenagers, we're still doing the same thing. We're allowing them degrees of independence suitable to their changing abilities, continuing to support them in their independence. As for managing record access as a parent, I was given internet access to my medical records. My 13-year-old was interested and I showed him how it worked. He asked about accessing his records. I assessed him as being mature enough with parental support. So we both went to our GP and we discussed the benefits and issues at length with our GP. He also assessed his abilities and maturity before agreeing. Initially, my teenager was given access to a CD containing his medical records to look through, and we looked through it together. Then he was given internet access online. As a parent, I also had access to his records. Our GP and myself, we continued to support him. At 14 years, together we assessed his ability as being fully competent to manage his own records. He'd had his records then for about a year. As a parent, I now don't have access to his records, but along with his GP, I'm still there to support him and to answer questions and prompt him as required. This is what I found as a parent. My child looks at his records in the same way as any adult would. There's no obsession, and he has an excellent knowledge of confidentiality and internet safety, perhaps better than my own. It's improved his own health management and knowledge. He makes healthy food choices and he keeps fit outside of school. He still needs prompting to make appointments or follow treatment, in the same way as you have to prompt teenagers that they need to do the washing up or take the cups out or tidy the room. The prompting's still there, it's just the same with medical records, but they know how to do it, it's just getting them to do it. He's able to see practice nurse, he's seen the practice nurse, the GP, the optician and the dentist on his own while I waited in the surgery now. And that shows some level of independence now. For health information online, he chooses, like most teenagers, Wikipedia, but he knows how to look for verification. He verifies the source of information. If he needs to know more, he can go on the GP website, and he can also has links to NHS Direct, and he can ask then to see the GP or practice nurse. As a parent, I feel confident that he's established a good relationship with his GP, and that he's confident in asking questions and obtaining information, following healthcare instructions and beginning to make his own choices and decisions for himself. People may wonder what were his issues as a teenager for having record access. Why would any teenager want record access. In my son's particular case, he had the same name and date of birth as another local patient. So that for him will always be in his best interest to be able to check that the information that's in his medical records is related to him and only him. He's also the best placed person to check those records. He has medical problems with his eyes and feet which weren't picked up at screening at a younger age. Both conditions were hard to spot and can lead to further problems or disability if left unmanaged. He's able to, and aware of their management and able to pass on this information to other future health care practitioners that he might see. It helps him to manage his general health and his health knowledge. He likes to keep informed like most teenagers and he likes to keep up to date. It also promotes an understanding of other people's health issues, which in turn promotes more social acceptance and understanding of disability and mental health issues in society. Such things as Tourette's, even if you don't know anybody who has such a thing, you might hear the word and not understand it, or somebody may not be able to explain it to you. That's somewhere that they can find out information, and the more information that they have, I think the more awareness of society, and I think teenagers themselves are much better at accepting new things and new challenges and accepting other people that are different. He will have to manage his own health fairly soon anyway. That was another issue. If he's away from home at university or college, and now that he's older on longer school trips abroad, it was better for him to do this in gradual stages now rather than having a sudden cut-off, as there'll be so many other things teenagers will want to do when they start to leave home. Oops. We wanted to find out more about teenagers at their health practice. So we produced a short film to find out what were teenage health issues. It was aimed at we produced a questionnaire. It was aimed at secondary school children and sixth form students, usually the ages 11 to 18. There's a simple questionnaire. There was only a few questions. Mainly we wanted to know who were they, does gender and age or the age needs vary, and it was an anonymous questionnaire asking just the age and gender. The 5 questions stated were just a yes, no or a tick box answers. We wanted to know which NHS services the teenagers were using. Are they already searching for health information sites on the internet, and if so, which ones? What was the best way of getting messages across to them, and what were their preferences? What health information do they need or want, and what do they need, and in what format? How do they want that information given to them? When do teenagers get a chance to speak for themselves? And that was the main theme of the questionnaire, that it gave them a chance to actually speak for themselves and say what they thought rather than people speaking for them. And it also gave them a chance to suggest anything new or anything that they would like to put forward themselves, things that they would like to hear. And that was all. Thank you for listening.